Good day. I'm Princess Diana Jem Tabo from BSN 111A. I'm going now to demonstrate the 12 cranial nerves. Cranial nerves are pairs of nerves that connect your brain to different parts of the head, neck, and trunk. To do is to test the olfactory nerve. Olfactory nerve is the first cranial nerve. It is a sensory nerve that functions for sense of smell. So I have a test for you, my patient. So please close your eyes, and I have a sample here. So you can tell me what kind of thing is this? What kind of smell is this? What smell is this? What kind of smell is that?
I smell it's surf.
Okay, that's right. For the second cranial nerve is which is the optic nerve. Optic nerve is the test in pass visual acuity, color, and visual fields, together with the usual component of its papillary reflexes. There's a two-test test that we need to do. The first test is the contraction visual field and the visual acuity. So the contraction visual field. Patient, you need to do is to cover your eyes in the right side, in also me the same side. Okay, so you need to have a distance like this. Okay, so all you need to do is to tell me what you need to do is to stare in this hand. What if what you see, if what you saw in this, okay, in my hand. Okay. 1, 2. Okay, good. The left side. 2, 3. Okay, good. And for the second test, which is the visual acuity, all you need to do is to ask the patient if she is using an eyeglass or not. So, are you using an eyeglass? No. Okay, that's right. So only first thing to do is to ask, is to read what's inside in the paper. So close. Okay, first is you need to close your eyes in the right. So read it. So you need to read it. 1, 2, 3, 8, 10. Okay, so and for your left side, 1, 2, 3, 8, 10. Okay, she got correct answers. Okay, so thank you. The next test that all we need to do is the oculomotor nerve, the trochlear and the abducens. For the oculomotor nerve is all you need to do, patient, is to follow where the pen it goes. Okay. Okay. Thank you. And for the next issue, all we need to do is to test, is to evaluate what happened after we test the eye movement. Next test is you need to see this in the center, in the middle. Okay, focus. Okay, right, good. All we need to do is the trigeminal cranial nerve, the fifth cranial nerve, all you need to do is to feel her muscle here and the temporal muscle here. So after that, can you please open your mouth? Okay. The patient is clearly okay. So thank you. So let's see. Let's see what happened to the eye after we test the motor nerve. Okay. Let's see. Your eyes. It's very clear. And for the same side, it's very clear. Okay. So the patient is good at looking in the center of this. After I test her, I evaluate that this is that the test is very good. And for the next test that we're going to do is a facial cranial nerves. So, patient, can you please close your eyes for me? Then open. Then, can you please smile for me? Okay, thank you. And for our next test of cranial nerves is the vestibulocochlear. This is also the hearing and balance test. So all you need to do, patient, is to tell me what have you hear. Okay, hear me. Okay. What's that?
Apple.
Okay. Or the right? What's that?
Orange.
Okay, that's good. Lesions produce difficulty swallowing, impairment of taste over the posterior one-third, or the tongue and palate, inference, and absent gag reflex, and dysfunction of the parotid gland. So our next cranial nerve is the vagus nerve, provides motor supply to the pharynx. Patient, can you please say ah? Okay. Which will cause the pharynx to elevate and observe the position of the alveoli. Okay, see the alveoli here inside. Okay, good. For the accessory cranial nerve, all you need to do, patient, is to follow me. All you need to do is first is to move your head up and down, then also move your head side by side. Okay, very good. And shrug. And for your shrug and shrug against my resistance. Very good. For the hypoglossal cranial nerve, all you need to do, patient, is stick out your tongue. Okay, then move it side by side. Okay, very good. That's all for today. That's all the 12 cranial nerves that I have already demonstrated here. Thank you once again. I'm Princess Dana Gentile Tabo from BSN 111A. That's all. Thank you.